welcome everyone. We're going to make a start, and people may join us later. We've got about 120 people signed up for this webinar, so thank you for coming. I know we only told you yesterday, but we wanted to just allay some of the fears and also answer any questions that you have around the COVID vaccine. So let's make a start. I'll introduce, so my name is Dr. Mahmood. We just want to kind of check in to make sure that we everything that we say in here is confidential, so please just only share things that you are comfortable sharing, and the tech is hopefully that is working. So some of you may not be familiar with Microsoft Teams. It's kind of similar to Zoom, I suppose. There's a little button there where you can ask questions. That might be the best place to post any questions that you have, and we'll try to answer those. We have left this fairly open, so if you could keep your mic on mute unless you're speaking, but anyone can speak, so I hope nobody says anything too inappropriate. So today we're really fortunate to have Dr. Deer, who's one of the doctors at our practice. There he is, that's friendly wave. He is, despite his youth and good looks, he is incredibly wise and full of a very talented man, actually, as it happens. Not only does he know a fair bit of COVID as of the last few days, where we've been reading all about COVID and all the vaccinations, he also is a very creative, talented person, and he plays the guitar very well. I'm Dr. Mood. I'll just kind of help to facilitate today, and we've got Chris. If you could say hi.
Hi, I'm Chris Jack. I'm head of primary care services for Hounslow. So effectively, I'm responsible for all of the GP practices and the services they deliver.
Excellent, thank you. So what we'll do today is Dr. Deer will outline some of the information around COVID, and then Chris can talk a little bit about how we're delivering that in Hounslow. This hopefully will make it kind of try to make it interactive. It only works if you contribute to that conversation. So please feel free to ask any questions that you come across, and also speak as well if you want to. It's nice when we take the presentation off. It'd be nice if you had your camera on, so we feel like we all belong to. We can talk to people. You can leave at any time. Please keep your mic on mute if you're not speaking. So again, feel free to share what you feel comfortable sharing, but remember that you're agreeing to respect the confidentiality of the other group members by not revealing any personal or medical information outside this group. So we've done the introductions. We'll outline what we're doing. Please think of any questions that you might have, and then we'll make a little plan. So this session today will finish at 6:30. We'll give everybody the opportunity to listen to each other's experiences. Please don't take any photos and videos. We will, however, be putting this on YouTube afterwards. And please, please, please contribute. So if you get any ideas, make a note of it. And it's all about you. So please, please contribute. It's your session, and you know, it is what you make of it. Otherwise, it's just a lecture from us, which is not what we want to do. So we'll give you summarize some general guidance, and then we'll outline some supports. And over to you, Vin. This is your presentation.
Thank you, Dr. Mahmood, for that introduction. So the COVID vaccine, so we're going to talk about today, and we'll just start off a little bit about COVID. So COVID virus, it actually produces a few proteins. One of those, which is called the S protein, otherwise known as the spike protein, that's what the vaccine is based around. So with COVID, most people develop symptoms in 5 or 6 days. A few people actually don't develop any symptoms at all, which is why it's even more important to try and prevent COVID spread. COVID first emerged, well, we noted it in Wuhan in China in 2019, late 2019, and the first 2 cases in the United Kingdom were found in late January 2020. So the vaccine that's been approved for use in the United Kingdom is developed by Pfizer BioNTech. It was approved on the 2nd of December, and the vaccine specifically targets this S protein, so the spike protein we discussed. So if you have a look at the spike protein on the picture, what actually happens is the virus itself produces these spike proteins, and they attach onto your human cells. They go inside the cell and they replicate, so they produce more COVID viruses, and then they come out of the cell. So what the vaccine actually does is it uses some of the genetic material of this S protein, and it causes an immune response in a person. So it almost tricks your body into thinking it has COVID. So it causes this immune response, and your body produces soldiers to fight against it. Those soldiers are called antibodies. So next time, if you're actually exposed to the real virus, your body will have antibodies and will be able to quickly fight off the virus. So does the vaccine actually work? So in the phase 3 trial for the Pfizer vaccine, and it was conducted on 44,000 patients, and those were aged 12 and above. Now, out of the patients that received the vaccine, it was found to be 95% effective, and that was across all the different ages, genders, ethnicities, and those with selected comorbidities as well. So the vaccine is given in a very similar way to the flu jab. So it's given into the muscle of the arm, the deltoid muscle. It is given in 2 doses, and they should be a minimum of 21 days apart. So who actually should be getting the vaccine first? So this is the joint committee that helped decide who gives the vaccination, who should receive the vaccinations first. And it's found that the very high groups are those of residents in care homes for older adults, and those staff that are working in the care homes for older adults. It's also recommended to be given to healthcare workers and those who are likely to be exposed to patients with COVID as well. So, of course, there will be a few people that cannot have the vaccine. So one of those, so in the news, you may have heard on the 8th of December, there were 2 members of staff, medical staff, that had a reaction to the vaccine. Now, there's different types of reactions that humans can have. So in the case of those 2 members of staff, they had an anaphylactoid, which is not as serious as something called an anaphylaxis. Now, those 2 members of staff had histories of allergies, and they both carried adrenaline, so epinephrine pens, because they had a history of allergic reactions. Now, if you do carry an adrenaline pen, or you have had a history of an unexplained anaphylaxis, or you've had this anaphylaxis reaction to any medications, any foods, or any vaccines in the past, then you should not be having this vaccine. So that's some new guidance that's been introduced. And just to clarify, anaphylaxis is a very serious and very severe allergic reaction, often in which the breathing becomes compromised, and you may get tongue swelling as well. Could I just remind, if you're not talking, if you just put your microphones on mute. Yeah, so other people that can't have the vaccine, so of course if you've had one dose and you've had a anaphylaxis reaction to it, you should not be having a second dose. And also there's something called PEG, for short of polyethylene glycol. So this is a very, very rare reaction, and if you've been known to have a reaction to this PEG, then we wouldn't be giving you the vaccine. So this is a huge paragraph, and I apologize for that. So there are a few cases to be aware of. So if you have got a minor illness, then you can still have the vaccine. If you are acutely unwell, so you've got high fevers and you're feeling very poorly, then we wouldn't be giving you the vaccine. There's no safety concerns about receiving the vaccine if you've had COVID in the past, so that's great news for you. And if you, let's see, so if you actually have COVID at the moment, then you would be asked to wait, and we would be telling you the duration to wait. And if your test, so the PCR test, is positive, usually we would ask you to wait for 14 days after that at least. So talking about side effects, so a lot of people are concerned about side effects. So the good news is that the side effects have been found to be mild, and they don't actually last that long, so they're short-lived. They last a few days only. Side effects, so one of the main side effects is pain at the injection site, as you get with the flu jab as well, which would last a few days and then go away. So fatigue, so tiredness, aches, muscle aches, and pains are also found, especially at the second dose. So after 21 days, when they receive the second dose. Now, very small percentage, so 1% may get lymph node swellings, so like glands around the body, but all of those side effects did resolve, and there were no lasting side effects noted for any of these.